Okay, questions. Any questions from the audience? Here we go. So yeah, this is definitely for Rish. How do you handle those cases that have some features but seem to fall short of calling it lymphocytic colitis? I know exactly what this person means. Rish, you want to take a stab at that?
Yeah, you can answer this too, John. But what I say is patchy, borderline. If it's enough that, yeah, it's right on that edge where it's not enough for lymphocytic colitis, but there clearly is more than what I would typically see. And I say patchy, borderline, increased, and it could be related to a medication or resolving like viral infection or something, or a very mild form of lymphocytic colitis. That's kind of my standard comment. I tend not to try to do that though. I try to, put it in one, it's either normal or it's lymphocytic colitis. But for those rare ones, I do it like that.
There's rare borderline cases. So maybe you mentioned this, and John probably has the same experience, and I'll bet you guys do too, is the increased frequency or tendency of gastroenterologists throw all the pieces in one jar, rule out microscopic colitis. So they're taking pieces from the right colon, transverse colon, left colon, throw it in one jar. We know that the right colon tends to be more cellular and actually has more lymphocytes normally than everywhere else. So any tips on that? Because you can get fooled if you look at a couple pieces into believing that it's lymphocytic colitis when in fact it's maybe just the normal pieces from the right colon.